Hello, my name is Lisa Maragakis. I'm a faculty member at the Johns Hopkins University School of Medicine and a site advisor for Medscape Infectious Diseases. Well, it's that time of year again, influenza season that is. And today I'd like to talk to you about the importance of and a few issues surrounding influenza vaccination of healthcare personnel. The most important point that I would like to make today is that vaccination of healthcare personnel protects our patients. In addition to protecting individual healthcare personnel from the risks of influenza, vaccination of healthcare personnel protects our patients from influenza and from its associated morbidity and mortality. Several studies show convincing data that the immunization of healthcare personnel is in some cases more effective in decreasing patient mortality from influenza than even vaccinating the patients themselves. This may be because older, more debilitated patients are less likely to mount an adequate immune response to the influenza vaccine, whereas relatively younger and healthier healthcare personnel are more likely to mount such an adequate response. Therefore, it is important for healthcare personnel to keep in mind that influenza vaccination is an important patient safety measure that we can take to protect our patients. A similar effect was seen in a study recently published in the New England Journal, in which infants had a decreased incidence of influenza and severity of disease when their mothers had received an influenza vaccine. There are two types of influenza vaccination available. There is the injectable inactivated influenza vaccine, and there is the live attenuated intranasal vaccine. Either of these is appropriate for the vaccination of healthcare personnel. Initially, there was some concern that the live attenuated vaccine virus might be transmitted to patients and might cause disease. However, this form of the vaccine has been used safely in the healthcare setting for the past several influenza seasons, and data have shown that the shedding of vaccine virus is at much lower levels than is required to be an infectious dose. And in addition, the vaccine virus is attenuated and it is temperature sensitive, further decreasing the risk that this vaccine virus would cause disease in patients. Therefore, the current recommendations from the Centers for Disease Control and Prevention are that either type of vaccine may be administered to healthcare workers. The only exception is among healthcare workers who care for our most immunocompromised patients, such as those who have recently received a bone marrow transplant. In summary, I'd like to point out again that we as healthcare workers have an obligation to protect our patients by receiving the influenza vaccine. And I'd like to remind healthcare personnel to get the vaccine as soon as possible now that vaccine is available, but to get it any time during the influenza season. Many healthcare workers do not get vaccinated if Thanksgiving rolls around and they have not yet received vaccine. However, please remember that it is better to become vaccinated at any point in the season than to go for the entire influenza season without receiving vaccine. There are several topics upon which I did not touch today, including methods to improve compliance among healthcare personnel with influenza vaccination, and other more controversial topics such as the use of active declination forms and whether influenza vaccine should be made mandatory among healthcare workers. If you have thoughts about these or other topics that are related to influenza vaccination of healthcare workers, please post them on the Medscape site. Thank you.